We earlier said that a restrictive cardiomyopathy is a disease condition where the heart muscles, or particularly the ventricles, are stiffened. Okay, so the muscles of the ventricles are kind of like stiff. Do you understand? Normally the heart should be able to relax. When it relaxes, it will now accept much more blood to now pump out. But in a scenario where you're having the heart muscles becoming stiff, that's what is known as what? Restrictive cardiomyopathy. The heart is normal shape, but it cannot expand more than this, which should not, okay? So when you say secondary restrictive cardiomyopathy, that means there's another disease condition or underlying condition that is causing the restrictive cardiomyopathy. All right. So we're saying that what underlying cardiac or systemic disorder, any underlying cardiac or systemic disorder affecting the heart may result into what? The restrictive hemodynamic, including what? Restrictive cardiomyopathy. All right. So if you have any underlying cardiac or systemic disease conditions, they can actually cause this, and which we'll be looking at examples of them. All right. So these are different cardiomyopathies, and you could spot out the restrictive ones. The restrictive one is more of like the heart is just normal shape. It's not getting big. It's not becoming elastic for much more blood to flow in. Okay. So the main category is where you are having the issue from what? The myocardium. All right. It could be infiltrative diseases like what? Cardiac amyloidosis, sarcoidosis, hemochromatosis. Okay. Then if the disease is from as a result of a storage disease, like examples of storage disease that can cause a problem to the myocardium, all right, and cause a restrictive cardiomyopathy. That means the disease is there, but it's now a secondary cause to this. All right. We have what? Hemochromatosis. We have Fabry disease. We have glycogen storage disease. We have, okay, I think that's all, right? Then any disease condition that can cause a problem to the endomyocardium, that's inside the heart, okay? Disease conditions like what? Endomyocardial fibrosis, radiation, that's like any chest x-rays too, all right, can cause a problem to the endomyocardium. Then toxic effect of what? Anthracyclines. Toxic effect of anthracyclines can also be a secondary cause of restrictive cardiomyopathy.